factor for success in IVF treatments. So if you're planning to do IVF, if you're married for long years, if you know your problems with the medical conditions and that you need an IVF treatment, don't wait for it. Every day you wait makes the chances much worse. So when you're young, it's better to try the IVF, because in young ages, it's really high success rate. But if you wait longer times, if you come to us over 40 years of age, 40 to 45 years of age, the success rates really drop sharply. So after 35 years of age, until 45 years of age, we can do the IVF treatment with much less success rates, but before 35, it's higher success rates. After 45 years of age, it's not possible to have an IVF treatment with your own eggs. It needs miracles to get pregnant at age 44 or 45. It's less than 1% success rate in IVF treatments. So in young age, it works best. In IVF treatments, the success, as we always say, the success depends on the woman's age and the embryo quality, and the third factor is the endometrium or the uterus. If the lining of the uterus is complicated with fibroids or any polyps or any adhesions in the endometrial lining, these are all adverse problems which negatively affects implantation rates and pregnancy rates. Any uterine fibroid or myoma inside the uterus has to be removed before any embryo transfer or any IVF treatment. If there is a polyp-like structure inside the endometrial lining of the uterus, this has to be removed by hysteroscopy. If there is an endometrial adhesion, hysteroscopic adhesiolysis, the opening of the endometrial cavity and healing of the endometrium is required before any embryo transfer. Any muscle disease in the uterus like adenomyosis, it usually comes with endometriosis, but it can be isolated adenomyosis. This is also a negative factor for embryo implantation. All the factors which might negatively affect the IVF results has to be treated before embryo transfers, before IVF treatments. So we check the uterus at the initial assessment before IVF treatment. When we see any of these problems, we make the treatment plan according to these gynecological problems. We solve them, then we start the IVF. In IVF, determining the gender of the baby is possible by embryo genetics. When the embryos come to day 5, there is an outer line cell group called trophectoderm. And when the embryologist does an embryo biopsy and takes some of the cells from the embryo, then sends it to the genetic laboratory, the genetics, can analyze the number of chromosomes and as well the sex chromosomes. And the laboratory, the genetics, can easily tell us if the embryo is a boy or a girl. But it is forbidden in Turkey. There is one condition in Turkey that we can just select boys or girls and do the embryo transfer depending on the sex selection in only one condition, and that is any genetic abnormality coming with sex-linked disorders. There are some diseases which comes to the boys of that family only or to the girls only. So in this condition, in order to have a healthy boy or a girl, we need to eliminate the other gender. This is why we do the sex selection in Turkey. We cannot do the embryo transfer depending on your wishes or selecting the embryos according to gender, because it is prohibited by law. Before IVF treatment, when the couples comes for an initial assessment or IVF treatment, we do the gynecological ultrasound determining the egg count, the ovarian reserve, any adnexial masses, any hydrosalpinx, any gynecological problems related with the uterus. Then we make some blood tests for the woman to see if she's ready for pregnancy. Any thyroid problems, any diabetes-related problems, any medical conditions, any vitamin deficiencies, all has to be treated or regulated before IVF treatment. So this is the initial step for women. For men, we ask for a sperm sample When we see the results of the sperm sample, if there is bad quality of sperm, if there is motility problems, if there is any accompanying varicocele or other like diseases, then we need to have a urology consultation, and we can give you pills also or any medications to resolve the problem. After we know all about you, all the test results comes together, we have IVF treatment plan, and that treatment plan just aims to have best or top quality embryos on day 5 in order to have the best chances of pregnancy. Even if this program is done and you at the end with best quality embryos, you couldn't get pregnant. If you have still frozen embryos in the laboratory, you still have your chance continuing, because you can have once more the frozen embryos transferred to you. Your chance comes with more than one embryo transfer cycle. But if the IVF fails and you had moderate grade embryos, bad quality embryos, or no embryos at all the embryos arrested, the doctor couldn't just do the embryo transfer. Something just happened not in the expected way. In these cycles, we need to go back, check the laboratory results, how many eggs you had, if those eggs are fertilized or not, if those embryos were good quality or not. If the embryo is arrested, what is the cause? Is it sperm related or is it related with women's any medical issues? So we need to check the treatment and to see the missing steps, and we can correct in some cases the steps we just had in the failed IVF cycle. Then we can start a new one. But if the one IVF fails, if you have the frozen embryos, you're lucky because you still have the chance. If no embryos or bad stories like bad embryo quality, you need to be re-evaluated from the start.